Hello, I'm Ethan Chazin, the host of the Chazin-the-Dream Workforce Culture Development Podcast. And I'm excited to have on our show today Matthew Sidney. Matthew is the CEO of Beanstalk Benefits, which he founded after 25 years of working in senior management, healthcare technology. Matthew spent the past 15 years building and growing companies that improve employees' access to innovative healthcare benefits and that make the benefits experience better for both employees and employers alike. So prior to joining Beanstalk, Matthew was the CEO and president of Picwell, which was an AI-driven benefits decision support solution that matched individuals to write healthcare benefits during open enrollment by predicting future care considerations, estimating employee out-of-pocket expenses, and accounting for individual healthcare preferences. Matt was EVP of Sales and Marketing at HealthEquity, a leading provider of health savings accounts, HSAs, and other health financial services. Previously, Matt held executive and management positions at LifeCare and IntelliHealth, which is an Aetna company. So, Matt, welcome to the show. Just want to start out by asking you, what was it about your background that compelled you to start Beanstalk?
Yeah. Well, first off, thank you for having me on the show. It's a bit of a passion play. Been in the space for a long time and continuously watching a little bit of stifling of innovation in the space. There's sometimes a feeling of good enough is good enough, and we're dealing with human beings. We're providing services that they should value, that they should take advantage of, and yet alignments aren't completely or incentives aren't completely aligned in the space. And so we looked at that and said, how can we get people the help they need when they need it, not on a calendar that is more institutional in nature, not be hampered by what we can select or what we can do based on a centralized budget, but allow people to get the help they need when they need it, the way they want it. And that was really what started Beanstalk.
And for the uninitiated, Beanstalk is this really powerful platform that enables employers to offer their employees, the opportunity to pick and choose from a breadth of options, benefits that are really customizable to what they and their families need. And I guess my curiosity was, you talked about not having a solution that was out there at the time that enabled that kind of employer-employee opportunity to benefit from that kind of a customizable platform. And I'm just curious, what in your background led you to this? What you talked about employees traditionally having that open enrollment period, and that's the only time they could do it. What led you to this? Because when you and I were first talking, you were talking about what the driving force was. I'm sitting here going, I was in corporate for 20 years. I wish that I had had the opportunity to pick and choose the benefits I needed the way Beanstalk offers.
Yeah, I think that part of the drive behind it is when I think about other industries, and we'll take financial services for a moment.
Yeah.
On my iPhone, I can log in a matter of seconds into a platform where I can purchase stocks, bonds, T-bills. I can purchase foreign currency, pieces of a jet, pieces of art, pieces of art. Yet in benefits, I can't do that. There's a small subsegment of solutions that my employer decided that this is what's best, maybe based on claims, maybe based on feedback, and that's it. Yet in the American workforce, we have 5 generations for the first time. We have more social and cultural diversity than we've ever seen. And yet budgets are getting tighter, benefits teams are getting smaller. The demands on the benefits professional is so much greater than it's ever been to try to meet these diverse set of needs, to try to meet these needs with a tighter budget. And it's almost an impossibility. And so I looked at it and said, well, why can't we be more in the benefit space? Why can't we be more like the financial services industry or any other industry and leverage technology to create hyper-personalization, to leverage technology to give me access anytime I want because my life changes, right? What happens in October in my life may be very different than what happens in February or March, and then may change again in July. So as my life changes, is my employer offering me benefits that I find help me with my current circumstances? I find them fulfilling and supportive, and I find them valuable, because that's why benefits are here, right? They're here to attract and retain employees. If I don't know about them, if I don't use them, how do I value them? And if they don't meet my needs, I'm certainly not going to use them or value them. So we looked at it and said, how do we really support the benefits professionals by taking the burden, right? By making technology the conduit to being able to offer hundreds of services. We don't offer hundreds of services today, but we will soon. And trust that we put our solution providers through a pretty stringent vetting process. We're constantly looking at them. We're constantly working with them to get better through the provision of feedback, through the provision of this is what we're seeing in the market, and being very transparent with them, because they're a key part of this ecosystem as well. And it's time to stop treating them as if they're second-class citizens, as if they're not as important, because they really are. And how do we get them and put them in a position to focus on getting better every day at what they're best at, which is delivering those services? Forget the sales, forget the marketing, forget those pieces. Those are all very important.
Right.
But we know how to do that. We want to help our solution providers by letting them continue to invest in the services so that the quality continues to get better.
Can we touch on that? Because I think that's such an important point. And in our previous conversations, you mentioned it even then, the I guess the drive that you feel to partner with solutions providers, to give them the opportunity to deliver extremely valuable services that bridge between employer and employee. So can you talk a little bit about how you pursue and develop the relationships with those solutions providers? Because when you were talking about the different kinds of benefits, I was blown away with some of the ones. I'm like, you can't possibly be serious about offering that. And you were.
Yeah, I mean, we have a pretty phenomenal support infrastructure, from our investors to our advisors, who tend to know a lot of folks. My team is very well experienced in the benefit space, so we have a wealth of connections. Now it's a question of identifying where are the needs. And we actually started in pediatrics, in talking with, tens, if not hundreds of employers over the last couple of years. It's not that pediatrics isn't important to them in terms of services. It's that they have to make a choice right now in an environment where there's capitation or per employee per month payments. You can't have everything, because you only have so much money, and you have to look at what's going to have the biggest splash, what's going to be utilized the most, and that's what we're going to invest in. But you get to the 80-20 world, right? So 20% of your population is using it. What about the other 80% and their needs? And they should look, or can now look, to their employer to tap into that using Beanstalk. We moved from pediatrics into women's health, from women's health into men's health, elder care. And as we were building up our community of solution providers, they also have connections, and they brought solutions to the table as well. And not every solution fits, because we don't offer or allow PEPMs, or per employee per month charges, on our platform. That doesn't work for everyone. So, and some don't meet our minimum thresholds around quality, security, privacy. And so we just ask them to come back when they do. And so from that perspective, what we found was there's some fantastic technologies, services, applications out there that are having a hard time breaking through to employers and ultimately employees, because it isn't diabetes, it isn't MSK, it's something a little more nuanced.
Hey, can I jump in though and just ask you, because this to me is so fascinating, is can you give some examples of those kinds of crazy kind of great benefit solutions providers that that you've partnered with and that are offered through the Beanstalk platform?
Yeah. We looked obviously we keep our eye on what's going on around the world and what's going on with various aspects of the population and children. I'll go back to pediatrics for a moment, critically important. And the way that you deal with a mental health issue or a developmental issue with a child can be very different than how you deal with it as an adult. And so we went out and started looking at different solutions. And what we walked away with after we did our assessment was there's no one solution that can do it. And so what we started to do is we said, okay, who can help with early childhood development and developmental delays? So the very first partner was Vital Exchange out of Cleveland. Phenomenal solution. Tends to work more with hospital systems and providers. We felt the quality of their service fit us very well. And it's 0 to 5. And then we move into a group called Hey Kiddo, which is a company started by a clinical psychologist. Actually, she was the largest pediatric clinical psychologist in the city of Philadelphia, the largest practice, which she sold. And then she said, I want to reach more people. And she built a business and built a service that deals with children ages 6 to 12. Because now you're moving out of the sort of from a developmental delay perspective, and emotional development starts to creep in, right? And the synapses are still forming. And then above that, we partnered with a group called Be Me for 13 to, I think, 20, right? Because now it's teen emotional health and there's a lot of strife and you're going through puberty. So very sort of laser focused. On top of that, we looked at it and said, well, not everybody deals with depression and anxiety in the same way, right? So we have a group called Spiritune that uses music therapy, which has been shown to be very successful, but a lot of folks don't tend to know about it, but uses music therapy to deal with anxiety and depression. Roulette, which uses an application either through your phone, your tablet, if you have like the Apple Vision goggles or the immersive technologies, so that we're giving alternatives and options to people to deal with their needs in the way that they want to, right? So music therapy may be right for me, but you may need something else. We want to try to meet those needs. I think the challenge in this space is you're hearing a lot about consolidation amongst the solutions. The challenge is you don't go to your doctor. Like if you go to a cardiologist, you don't go to them and expect them to work on your feet or your ears. You go to them because they're very good at what they do. They're experts in that space. This really is no different. No one can be everything to everyone. And so we looked at it and said, well, then we want to be very deep in certain areas, whether that is pediatric mental health, whether that is genetic testing for newborns, or that is sports injuries or concussions for children. So trying to make sure that we are filling gaps, number one. I don't want to step on a broker's or consultant's toes. I don't want to step on the health plan's toes by any means. That's not the interest. The interest is making sure that the services that we're providing are filling those gaps and meeting the needs of the employees. Because if they value them, they're using them. That's what the employer wants. And doing it cost effectively.
Oh, for sure. And you talk about benefit from two perspectives, or you have so far. One is the solutions providers who are offering the services that are made available on Beanstalk. The second is the benefit to the employee and their family members, which you talk about all the way from, a newborn all the way up through somebody, elder care. And what I'm not hearing it yet is the benefit to the employer. And
Yeah.
I always, in my world, when I talk to employers, I always hear hesitation. I hear reasons why we don't do things. Can you talk a little bit about the many or the benefits you shared with me about this platform from the employer's perspective?
Yeah. And it's a good point, Ethan. I think in our world, at least at Beanstalk, we believe that incentives should be aligned. That means it's good for the employer, it's good for the employee, it's good for brokers, consultants, it's good for the solution providers and everyone in between. With the employer, as I said earlier, it's a bit of an impossible task, right? They're being asked to do a lot and a lot more every day than they ever have been, but with less. We looked at it and said, that's technology can help solve that problem. So number one, from an administrative perspective, when an employer works with Beanstalk, we look like one massive point solution that continuously adds more services, but they don't have to recontract, they don't have to reinstall, they don't have to manage a whole new set of solutions. They don't pay for a new set of solutions. What it is it's one contract, one report, one bill to pay, and one set of reports and platform. So it makes it very easy for them. So that's sort of one on the administrative burden side. On two is they have to trust that we've put our solution providers through a due diligence when we make our selection. And that's why we created our vetting process. We tested it and retested it. We continuously look at improving it because I want them to feel comfortable that the services that they're offering to their employees, they can trust are going to work, whether that's outcome driven, whether that is experience driven, regardless of that. The point is their data needs to be protected. It needs to be easy to use, and it needs to have, an outcome, a desirable outcome, and be able to demonstrate that. The last piece is around the dollar. Because employers are, financially tested every day, we're tested every day, right? The concept of per employee per month or capitation is really an insurance, a way to deal with insurance. You pool money from everybody and a few people use it. That's how capitation works. We looked at that and said, these are services. It shouldn't work that way because, and employers, at least when we've gone out and spoken to employers and did our initial surveys and interviews, they're kind of tired of paying for things that employees don't use. Sure. In the Beanstalk platform, you only pay for what you use. So there, as I said, there are no per employee per months allowed on our platform. Everything is a per visit, a per test, per diagnostic, per membership. The employee decides what they want. We give them a facility, a multi-purse digital wallet that they can use to go buy the services that they want anytime. And that includes the ability for the employer to subsidize it through a lifestyle spending account or an LSA. Employees can tie their HSA or FSA into the system. And a lot of our services, most of our services are qualified medical expenses that they can use their HSA or FSA dollars on. And we tell them what they can do and what they can't with that. They can tie in their own personal credit card if they so choose. And we also offer a debt vehicle. So trying to remove the burden of cost from the equation. I mean, if you want good services, you do have to pay for them. But there's so many vehicles that folks have that they're not taking advantage of. The amount of dollars that are left over at the end of a year on an FSA is pretty mind-blowing. People still are, I've been in the HSA space long before I got into Beanstalk, and people don't properly use it all the time. And they might choose to use their HSA for pediatric mental health if they knew they could do it, or for therapy if they knew they could do it. But they're not aware. And so awareness obviously is critically important to us. But the idea of giving agency to the end user, to the employee and their families to make their own choices, but not adding significant cost to the employer is really important because that's the gateway to all of this.
It certainly makes complete sense when you talk about the model from a cost containment standpoint as a benefit for the employer. But I'm also wondering from the humanistic side of it, right? I mean, a lot of organizations I talk to, they don't typically talk about the things that they offer to their employees for humanistic reasons. Like you've kind of walked me through a very kind of detail-oriented kind of cost structure pass through to employees. But is there some other aspects to this whole Beanstalk platform from an employer standpoint that screams out benefit to them from an other people consideration standpoint? I don't know if I'm kind of framing it the way I have in my head.
Yeah, no, I if I'm understanding your question correctly, there's been sort of a pretty significant trend in the U.S. workforce around things like DEI, as an example. Mm-hmm. And when I think of DEI, it's not just the diversity side of this. Then we think about race and religion and sexual orientation. There's also sort of health, right? There's a health diversity, right? We're currently looking at neurodiversity partners right now. And it's so exciting to see some of the solutions out there. And so just, I mean, imagine the impact on someone who's trying to have a child, is unable to do so, but when they call their insurance company, it's IVF. IVF's not the only option. It really isn't. We have a partner in Frame Fertility who can help someone go down the path of looking at a lot of other alternatives: surrogacy, egg donation, adoption, right? It's not just IVF, and there's nothing wrong with IVF, right?
Right, right.
Just not, there are other options. And some people may have concern about it, or concern about the cost, or even concern from a religious perspective. Irrelevant to me. What's relevant is they're their own person, they're unique, and how do I offer them the opportunity to look at all of the options in a way that they can feel comfortable? And then to take it a step further, we formed a relationship with a company called GoStork, which has a massive database, maybe the largest in the United States, of egg donors, of surrogates, and can help with adoption. So we sort of take it that next step, that it's not just telling you the path to go down, but here's an option that you can actually take advantage of. Because if we really want people to be present, and we want people to value their jobs, and we want them to be happy, inherently we all want to be happy, right? We just have very different life circumstances, and what makes me happy may be very different than what makes you happy. What makes me feel loyal or makes me feel like I'm being valued at my employer may be very different. With Beanstalk, you get the opportunity to sort of start to tap into that, whether it's something that has to do with my family, something that has to do with me, something that has to do with a family I want to build that I don't have yet. And so that's kind of how we're thinking about it.
And the thought process, when you talk about from your perspective, kind of architecting out the totality of this, uh, I'm hearing something from the employer perspective. I'm hearing you are giving me an opportunity to offer an entire, as you said, health diversity, living circumstances, set of benefits for me to offer my employees, which will create so much relationship, trust, and value as the employer giving it to the employees. I really feel this strong kind of bond forming with a company that's being able to offer people at that moment in their lives the health protection umbrella or the benefit spectrum. And you said people's needs change constantly. It's not something we can plan quarter to quarter or one time a year. It's our lives, and our health is, and our family's health is always changing. I'm just, that's one of the first things that when we first got to know each other and you told me about Beanstalk, that it just was crystal clear to me. I'm just always wondering why more organizations aren't doing things like this. Like you said, health, we have an app for that. For financial services, we have an app for that. But I just always wonder why benefits in health, not so much.
It's harder from the perspective that you have a business, you have benefits to provide, and oftentimes the benefits team is, benefits is a cost center.
But
And
benefits is a cost. But do people, when they talk to you from the employer side, make the connection with benefits as a world-class employer, best company to work for? Are they starting to kind of think along those lines? Or is it the conversations mostly still that you have around cost?
it's not always around cost. Absolutely not. And we try to head that off at the pass right away in our conversations, specifically because we can help to curve that. It's not an expensive solution to begin with. And you, as the employer, decide how much to spend. And if you want to adjust it along the way, you can do that as well. So flexibility is important. I think what you're getting at, though, is what's critically important is people just, they want to be heard. They want to be valued. We all work very hard. You go to work 40, 50, 60 hours a week, come home to your family, and you're not spending as much time with them as you are with people at work on any given day. And so by feeling heard, by feeling valued, it's motivating, right? It's motivating you to do your job better. It's motivating you to be more detail-oriented. It's motivating you to enjoy what you're doing. And when we look at benefits today, and a perfect example of being heard, if you called your insurance company tomorrow and said, hey, I'm really interested in pet insurance, or I'm really interested in veterinary telemedicine. They're going to say, awesome. And they're going to go about their business. What we're actually doing is we have a smart search capability that's tied into our engine. And what we're doing is we're monitoring what people are searching for. And if it's consistent, consistent is not thousands of times, it's tens of times that someone's looking for something or people are looking for something and we don't have it, we'll go out and find it. And then we'll alert, we got it. And veterinary telemedicine is a perfect example. In our pilots, we heard employees looking for that. They wanted, because if it's a Sunday, a Saturday, it's at night, and your dog gets sick, your only option is the emergency vet.
That's right. Yeah.
Which is incredibly expensive and is a great service. Don't get me wrong. I've been there many times myself. But if I had something that I could maybe as a first pass, talk to a vet, show them what's going on with my dog through my camera, and that could save me a lot of money and make sure that my pet is healthy. And the fact that I told Beanstalk, which is being offered by an employer, and they're listening to me, and they went,
Yeah.
it's powerful.
That to me is of all the many benefits that we've talked about, and what I came away so impressed with when we've spoken previously is you're monitoring in real time the usage of the platform and what people are looking for so that you can modify constantly or add new services based on what people are looking for.
Mm-hmm.
And that's so proactive in terms of historically my own anecdotal experience in corporate, it being a reactive process of these are your standard benefits. They never change. Once a year, you get to add yourself and maybe some family members, rinse, wash, repeat. But the evolution of the platform in real time is just really striking.
We couldn't have done this 10 years ago, but the technology
Why?
exists.
What technology exists now that enables that?
Well, artificial intelligence is
Okay.
powerful.
Okay.
Our ability to monitor transactions, monitor requests is much easier now, much less expensive, quite honestly. If I were Google 10 years ago or Amazon, maybe, but entering the space would be very difficult. The concept of leveraging technology is obviously not a new one. We were talking about the financial service industry before. I mean, being able to do amazing things. It's just been a little slower in the benefit space. And so we've looked at it and said, we can we can bring together sort of this concept of high touch, high tech, lead with the tech, and rely on the experts to do the human touch, which are the service providers, right? I can help them make the connections. I can help them see more people. I can help them. I can bring patients and users to their door, and then they take over from there. And they're doing what they do best. They're doing what they're passionate about, or what they've been trained in, rather than trying to worry about, I've got to build all of this technology to get to these people. And it's really just a division of labor when you think about it, right? We'll focus on what we do best. You focus on what you do best. Now we'll use technology to connect. But always keeping in mind what's in the best interest of the user, the employee, and their families.
We could talk about this forever, and unfortunately, we do have to kind of wrap up at some point. But I feel like that's a perfect opportunity, what you just said, to tie a little kind of Tiffany bow in this is the benefits, the three-way benefit of the employees for sure. The employers obviously benefit tremendously from a platform like this, and also the people who are so passionate about providing the services to both, but not having to worry about the technology as the bridge, because you've architected that. And I guess if somebody were either on the employer side or a provider and they wanted to reach out and say, hey, Matt, I heard what you had to say, and I really think that we could benefit from this, how would they get in touch with you?
Sure. There's several ways. You can reach out to me through LinkedIn. You can go through our website, beanstalkbenefits.com. Lord, if you see me passing by, you can wave me down. So there is lots of ways, and
You'll be walking your dogs.
they'll be walking my dogs. We've assembled a pretty fantastic team. And when you and I first met, and I joked about I'm the dumbest guy in the room all the time. I literally am the dumbest guy in the room all the time. I mean, they're incredible professionals. They're very good at what they do. They're very well connected. And we've aligned ourselves with advisors that are also incredibly tapped in and incredibly passionate about why we're doing what we're doing, which is so different. And by the way, what we found recently is, and this is maybe closing with this, it doesn't matter if you work for Boeing or Google or Amazon, or you work for Joe's Pizza or the small veterinary clinic down the road. 5 employees or 5,000 employees, it doesn't matter. We feel like everybody should have access to world-class services and benefits. And so as part of that journey, we took ourselves all the way down to 2 employees in terms of what we could service. And we said, well, why don't we take it to 1? Why don't we go to direct to consumer as well? And so that's coming. And then we found the wonderful world of gig workers and 1099s. They need help. They don't always get the benefits. They're no less important. They're as important as the employee because they are employees. They just work on a different schedule. It's a different construct. But how do I bring services to them that the employer can afford and give them optionality?
That kind of 100% customization from size of firm in terms of how many employees, but always operating under the implicit assumption from, again, a humanistic standpoint, as you said, is healthcare and the right to health and benefits shouldn't be exclusionary.
Exactly.
It should be something that everybody can access. And I'd be remiss if I didn't take a moment to say, Matt, thank you so much for not only coming on the program for sure, but in kind of leading this initiative to create an online platform like Beanstalk Benefits. So, and all of your contact details I'll put in the description below. But again, thank you for coming on the program today.
Ethan, thank you so much for having me. Really enjoyed it.
Absolutely my pleasure.